I'm delighted and honored to introduce someone who is no stranger to this group at all. Betsy Chapin Taylor, as you all probably know, is the president of the healthcare philanthropy consulting firm Accordant Philanthropy, and also the author of a number of books, several of which she has done in conjunction with AHP. I know I have read a number of her books, and I have one still to go on my night table back at my apartment. I asked Betsy yesterday, told her I was going to introduce her and asked her if there's anything in particular she wanted me to say, and she wanted me to let you all know that she absolutely loves and adores AHP, and that AHP gave her her roots and her wings. So without further ado, Betsy Chapin Taylor, thank you.
Thank you. Thank you. Good morning. It is my pleasure in turn to introduce you to two women who have been part of a Cinderella story. When you look at Martin Luther King Jr. Community Hospital in South Los Angeles, please come up. When you look at Martin Luther King Jr. Community Hospital in South Los Angeles, this is a place that has been ground zero for caring for the disadvantaged and the vulnerable. It has been a place of persistent poverty. It has been a place that has been punctuated at times by gang violence, by race riots, and by other challenges. And as a result of a variety of factors, their hospital closed in August of 2007. Please have a seat, make yourself at home. However, the community knew that they needed an incredible hospital. And so they rose like a phoenix from the ashes and didn't just build a hospital, they built a hospital of the future. They built a hospital that has become a model for many other organizations across our country. I believe we're going to start with a short video from them, but I want to introduce you to these women. Dr. Elaine Batchlor is the president and CEO of Martin Luther King Jr. Community Hospital. She has a medical degree from Case Western and is board certified in internal medicine and rheumatology. She also has an undergraduate degree from Harvard and an MPH from UCLA. She's been recognized as one of the top 25 physician executives in this country and is one of the top CEOs in this country. She is joined by her leader for philanthropy, Diane Sublett. Diane has spent 40 years advancing philanthropy in a variety of different places. She's been with the YMCA, she's been with Sundance, she's been with the Zoo in Los Angeles, she's been with a variety of different organizations. She also created models for engaging women in philanthropy that have been replicated across the country. So I bring you to these two actors in this Cinderella story, and we're going to have a communication today around partnership. But first, we'll start with this video. Is there audio to it?
I think it's just a loop of photos.
Okay, it's just going to be photos. So, wonderful photos. We can keep watching the photos. So with kind of that setup, Dr. Bradshaw, I know you came to Martin Luther King Jr. Community Hospital in 2012. So 5 years in the wake of this hospital closing, and you had to have had an audacious vision in your mind to be able to build what is there now. So as you started, how did you and Diane and your other leaders start to craft the vision for what this would become?
Sure. So we took on a task of opening a brand new hospital and creating a brand new organization on the ashes of a failed hospital. And the first thing that it took was a group of people who were not averse to taking risks, who were willing to step into a situation that most people felt was not workable and were afraid to have anything to do with. Most people said to us, good luck with that. Yeah. And so I think the first ingredient was just a group of people who were entrepreneurial, who had been successful in their careers and weren't afraid that a failure would be a big stain on their careers. And I think we were fortunate to recruit and attract a fundraiser who had deep experience in philanthropy, who'd already had a long, successful career, and who was as much a risk taker as the rest of us. And we had that in common from the beginning.
Absolutely. So on one hand, Diane, I see this compelling woman that you went to work with, but you took a huge risk. You had a very successful career. You had never worked in healthcare before, and all of a sudden you're going to work for a hospital. What gave you the courage to jump and go work with Dr. Batchlor?
Well, I would like to say that the hospital and the group of leaders, it was not yet a hospital in 2012, but the small group of leaders also took a risk on me. And in that sense, they were looking for an experienced fundraiser, but I didn't come out of healthcare. I was not maybe a natural exec search choice for that particular role, but I was warned by many of my colleagues, some of whom were in healthcare, as Dr. Batchlor was warned when she was considering her role. No, have you really thought about this? Have you thought carefully about this? And the caution was always your career and how hard it's going to be, if not impossible. And some of the closer friends said, you'd be crazy to do this. In other words, they took with me, I didn't know about healthcare. For me, it was an upside because of the range of roles that I've had in different sectors. I love to learn. I was not afraid of learning. I knew the grounding of my work. I had relationships throughout the city. And in that, I felt confident. The risk that they took with me was how fast can you learn all those acronyms? Yeah. You know? Because it was a lot of acronyms. I would say that being matched up with Dr. Batchlor was key for me because she is by nature a teacher.
Yes.
Not too long ago, actually, we sat in her office and she spent an hour and a half impromptu with pieces of paper, drawing things, teaching me the ins and outs of a managed care organization. And I thanked her later and said, it was great to have that teaching, and thanks for your time for that. And she said, it's important to me that you know everything so that you can represent us.
Yes.
You know, one thing I would add that I think we also had in common was I was not a legacy hospital leader. I had never led a hospital. I had spent most of my career in population health and managed care. And I love to learn new things, and I love new challenges as well. And so I think we both brought that to this undertaking, and we had that shared enthusiasm for learning something new and creating something new.
Absolutely. You know, I love when you mentioned shared enthusiasm. It seems like you also both brought shared values to this. How important was it that you both had a shared sense of values and a desire to affect community impact?
I think it's critical that it's a base, it's a foundation, it's something that we touch base on all the time, but it's not something that we question because we know in our hearts that this is what brought both of us to this challenging, risky task, was our value for improving lives and for creating equity in health for underserved communities.
You know, one of the things that we think about when we think purpose and value in the nonprofit sector, right, is the value, in our case, of serving the underserved and bringing health. But what was different and very, very important to me was the value of quality health care. That value of not just bringing health care, but we like to say now that quality care is a radical act of social justice, because that quality was a value that we brought to everything that we did in our culture, right? From not only opening the hospital, but how do we set up the culture? What are those expectations? Quality care as a value was really what drove this whole enterprise and still drives us.
And I think it's part of what makes our partnership so successful and productive is that we're both A-plus students.
I know,
So we both strive for doing the best in everything.
Absolutely. Well, so it is interesting, though. Like, you came to this with a background in medicine and in healthcare, but no philanthropy. You came to this with lots of philanthropy, but no healthcare. So in great partnerships, I think we figure out how to play to our strengths.
Absolutely.
How did you learn to play to each other's strengths?
I think that's absolutely true. And in general, as a CEO, I believe that I'm most effective when I leverage the strengths of my team and shore up their weaknesses. And I think it just is a matter of time and working really closely together that allows you over time to understand what someone's strengths are and what their weaknesses are.
I'd like to illustrate that, if I might, right
Yes.
now, strengths with a little story. Dr. Batchlor mentioned that she did not come with training or experience in philanthropy. As a matter of fact, she was a little, like many,
I admit it was the last thing I ever thought I wanted to do.
Go ahead.
If you had told me that I was going to spend my time fundraising, I would have said, I'm sorry, that's not the job for me.
So here's my story. The very first visit I took her on. Now, I was hired 6 months before Dr. Batchlor started. I had a little bit of a runway. The very first meeting I'm going to take her into, the head of a major foundation in Los Angeles, and this was going to be on a Monday. And in Baltimore, or not Baltimore, in the area where her mom was living at the time, in the DC area, her mom lived alone, fell, broke her leg on a Thursday. She needed to fly out and, of course, be with her and manage that care portion. I said, let me reschedule the appointment, and she said, no, that won't be necessary. I will be there. I will be there for you. And Dr. Batchlor took the red-eye flight, landed at LAX at 8 a.m., by 9:30 a.m. was in the lobby to meet me to go upstairs for our 10 a.m. appointment. That is the kind of commitment. It didn't require expertise, right? It didn't require anything but a commitment. I will be there for you because I know this is important. Now, I will also say that in that meeting, we had the introduction. That was all it was discovery and setup. But I knew that the CEO would probably resonate to Dr. Batchlor, and she did. She invited the question, what is your big project? We laid it out for her. It's a maternity campaign that we need to launch. She says, well, I think that we could probably entertain a proposal in the $500 to $750 million range. And I took a beat and I said, you know, Wendy, we are actually looking for leaders. We've got a lot of people hoping we might succeed, but they're all standing on the sidelines. And we're looking for somebody who will step out in front. And she looked at both of us and then looked at me and said, you want $1 million, don't you? And I said, yes, Wendy, I do. And she said, okay, let's see what we can do. We got into the elevator, and I said to Dr. Batchlor, it doesn't always go that way.
Absolutely.
Just so you know.
But Diane always asks.
But I do always ask. And it's a wonderful example of, it didn't take expertise, it took commitment. And I think that in our partnership and in any partnership is what is key.
Absolutely. So I want to kind of put those two thoughts together. So Dr. Batchlor, I think a lot of CEOs come to this and say, oh, fund development. I don't know that that's my skill set. I don't know that that's my comfort level. But being with this woman who sees the nobility of this work and going on calls like that, where you have a community partner who wants to step up, how do you feel now about philanthropy?
I love it. And I love philanthropy. I enjoy fundraising, and I feel that we're very effective working together at fundraising. Diane makes it easy. So, if people ask me, what's the key to a successful partnership? One of the things I would say is make it easy for your CEO. And she makes it really easy for me. She does the background. She does a briefing before every meeting or event. She tells me what we need to accomplish. We craft stories together. So I would say one of the biggest things that we do together is create stories. And it makes it incredibly easy for me to be effective.
Yes. So it's interesting, in a lot of organizations, we see them put forward projects for philanthropy that are often part of an incremental vision because they're afraid that the money is not going to be there. They don't have the guts to be audacious. Yet you were sitting in one of the poorest areas of Los Angeles and wanted to build a $300 million hospital. Diane, I've met a lot of folks in very well-heeled communities who would have said, we can't do that. As you started thinking about building a tribe around this, where did you start and how did you engage Dr. Batchlor?
You know what, we started where we are today with partnerships, not only our own, but the understanding that what we want to do, and by the way, the hospital is only the starting line, it's not the finish line.
We're building what she just said.
That's right. We are building that. And that requires a lot of partnerships. Where did we start? We started with this conviction, and we were just talking about it over dinner last night, that we don't talk about numbers anymore. I've talked about numbers my whole 40-year career. What are your annual goals? What are your capital goals? What's the number? What's the number? What's the number? Hit your finish line. I love numbers. I wake up counting. I love exceeding my numbers. I'm an A+ student. But at the end of the day, what I realize is different here. We never do that. We talk about what does our community need? What are the obstacles? I never have Elaine coming to me saying, we need to raise more money. She comes to me saying, we really do need to be out in the community with a hospital at home program. How are we going to get that done? We need to hire more doctors. We need to bring doctors into the community. And we sit around and talk and say, how are we going to get that done? And Dr. Batchlor says, well, you know, that's not a philanthropic case. After all, income for doctors, that's not a philanthropic case. And fast forward $15 million, Stephen Connie Ballmer and the Weingart Foundation, we didn't talk about the dollars. We didn't talk about the salaries or the income. We talked about what this community needed and what we could demonstrate for other communities, right?
And I think the other thing is that we've made our donors part of our community as well. So they become members of our team. They start to invest in the work that we're doing, and then they've tried to enlarge that circle. So they've gone out and they've become evangelists for us as well. And they're bringing additional people to the table and to the circle because they believe in the work that we're doing and that they've become part of our team by building those relationships.
So, you know, with that, often the CEO is the one who's got to unlock access to those allies, to those evangelists. How have you helped engage others in philanthropy?
Well, I think part of it starts with getting people to come to the community and the hospital and see what we're doing. That seems to be a huge first step. And once we get people to take that step, they want to take the next step.
And so that all of you, can you all hear me now? Great. So that all of you can imagine this, we all do this, right? Get them to our mission, get them to the place. The difference for us when we say get them here is people are thinking South LA, they're thinking Watts, they think they know what they'll see. They're also thinking county hospital, we are a private hospital, but they still think that because they think public services, right? We bring them into a state-of-the-art facility that received in 2014 the Los Angeles Architecture Award. The minute they walk in the door, the first thing I hear is, oh, this isn't what I expected. You know, this is beautiful. And then we start telling our story. This isn't what I expected with this talent, one of the top physician CEOs in the country. This isn't what I expected, the female chief technology officer who's awesome, the talent around us. Once we get there, it's not like your standard tour where you can show, oh, these are all the people who need us. You know, we actually don't do that. We surprise people. But once we get into conversation, we show our determination, right? This is what we are going to do. Would you like to join us? This is the opportunity that we're laying in front of you, and we make them want to be part of our family. Now, we do the hard work, too. I mentioned the Ballmer and Weingart situation. When we were invited for that proposal, it was a question that came up, well, do you have a business plan for the medical group? And Dr. Batchlor says, of course we do. And I walked our donors out and came back, and she's standing with the chief the CFO and the CMO. And she said, "Do you guys have a business plan?" And then she turned to me and she said, "Have you ever written a business plan?" And we had 3 weeks. And I've never been so terrified in my life. I'm a great writer. But the next day she brings me a book, puts it on my desk, Business Plans for Dummies. She said, "Don't worry. All you have to do is read the table of contents. You're good, you're good. You know, just figure out how to organize it." And fast forward, we did get that business plan done. And it was the work that we needed to do, right? It wasn't just the wonderful stories. We had to show the pro formas. We had to do everything that needed to be done. But that was the moment when we realized that we got this. You know, we might not have everything lined up, but we were so determined that we were going to get it done.
Absolutely.
And that's when you make donors part of your family, and that's part of the emotion, but you also do the hard work of quality. And not only did we have the business plan done, but I had it designed. Yeah, and presented.
And it was reviewed by 2 different consulting groups.
Yeah, our donors had it reviewed by 2 different consulting groups. I never want to do that again. That's not the fun part of my work. But I received an email the other day from one of our donors with whom we had been close and made a part of our family. And I had reached out. He was very busy, didn't have time for an appointment. By email, asked to help start something. And I said, the starting point is $10,000, and I need you to help me start a group. And he emails back and he says, "I'm in for 50. And then he says, "You know, every time I get an email from you, it makes me feel happy." And I thought, I just asked this guy. So that's part of being part of the community. It's not just the ask. It's about how people feel when they're part of success, right? Because we continue to do things that they say couldn't be done.
Yes.
And we were listening to a lot of what's happening in government. We do have to work with government as our partner. And we had an experience a year ago where we were puzzling over something very important that had to do with bringing more doctors. We have a gap of 1,200 doctors in our community, in our service area. And it had to do with a set of laws, actually, in California. And Elaine, we were walking. She says, "Well, let's change the law." I said, "Oh, okay. Well, let's go find us a really good government affairs consultant, and let's get on that." And on April 9th at 1:30 in the afternoon in Sacramento, our assemblyman is presenting our bill.
Excellent. Excellent.
Now, that doesn't mean we'll get all the way there, but I'm the Chief Philanthropy Officer, and I'm trusted enough to go in on this kind of thing because
Absolutely.
it's whatever it takes.
So, Dr. Batchlor, clearly Diane has earned your trust. And we know that trust is a bedrock of great partnership, but it's also something kind of elusive. How did she earn your trust?
Well, I think we've been through a lot of challenges together, and just over time, her coming through for me and me coming through for her, getting to know her as a person and developing a friendship as a person. I think it just happens over time when you're there for the other person through thick and thin, and when you see what is being delivered consistently.
Yes.
You know, she mentions time a lot.
Yes.
And one of the things that I recommend to staff members of mine, always learn your CEO style. We've worked together since 2012. We've never had a scheduled meeting. Not a single one. Now, I used to do that with my other CEOs, of course, our standing meetings, the agenda prepared. I recognized very quickly that Elaine had an informal style, and I asked myself, well, maybe try this and see how it works. I also recognized that formal meetings often don't seem like very much fun, and that since her door was open and she was very accessible, so access and adaptability are part of this, we just started standing in each other's doorways. Let's go for a walk. We do a lot of walking around campus, walking into South LA if we have something long to think about. And I think over time, that has built a lot of trust too. On those walks, we'll talk about a big problem, but we'll also talk about our families.
Absolutely.
We talk about movies that we've watched. We share books back and forth.
So, Dr. Batchlor, it sounds like Diane's style in some part has been fluid and responsive to your style. How has that enabled you to have a better partnership with each other?
Well, Diane is very emotionally mature, and with some people you might get into conflicts when your style isn't exactly aligned with theirs, but with Diane, she really does accommodate to my style. And when we have things that go wrong or an issue, neither one of us allows that to impact our relationship. We don't clash with a lot of ego. And I think that is part of what makes the trust work and what makes the relationship work.
Absolutely.
I have a little story to illustrate trust, if I might.
Sure.
And it is in the opposite side of our work in philanthropy, but still very much part of it. Not too long ago, we had some donors visit from a foundation that I had actually tried for several years to get here. And wonderful things happened, and over time they invited the proposal. And then we had this site visit, which you always get from a program officer while they're preparing to present to their board. We were invited to request at $250,000 for a particular program. Two officers were assigned to the site visit, one I knew very well and liked quite a bit. He came, the other one was on the phone. The conversation included on our side, I had two vice presidents in the clinical areas. It went south in a way that was hurtful to my vice presidents. The person on the phone didn't have the advantage of body language, but there was some disrespect expressed. And then there was also, and this was key, the suggestion that they might want to redraft our objectives in our program. I went, after some thinking, to Dr. Batchlor the next day and said, I would like to withdraw our proposal before it reaches the board. And, there's $250,000 for a small community hospital for an important nurse training program. And she said, why? And I told her, and she said, I would like you to find a way to let them know why we're withdrawing. So I called the program officer with whom I had trust and a good relationship, talked about a lack of alignment in mission, and was candid about what happened in that meeting. He said, this was a Friday, could you please give me until Monday, and I'm so sorry. Now that trust, having your CEO said, yes, you may withdraw that proposal. On Monday, he called and he said, we'd like to do two things. We'd like to ask you for a little more work. We want to assure you that we will not touch your objectives, and we would like to have you redraft your budget for $450,000. So we received a much larger gift, but it was not a point that I expected, and certainly not where I was going. The point was you had someone who trusted you saying we stand for our values,
yes,
and you cannot redraft our objectives on our programs.
Yes. So clearly the two of you have enough relationship equity that you felt permission to pivot in that moment. But I would think that also with that deep relationship equity, you also have the permission to disagree with each other and to rumble. When have you ever had to have tough conversations with each other, and how have you handled that?
Sure. So, one of the things that I know is that there's some things that Diane doesn't find very interesting to raise money for, and equipment is one of them. So we needed an MRI machine before the hospital opened, and I came to Diane and I said, Diane, we need an MRI machine, and I need you to raise money to pay for it. And she looked at me and she said, no way. No one wants to pay for a machine like that. And I said, well, I'm sorry, we're just going to have to do it. You're going to have to figure it out. And I think typical to Diane, at the beginning she would be resistant, but after thinking about it for a while, it would turn into a challenge. And she did figure out how to do it, and we did get the money, and we did get the machine before we opened. And so sometimes it's just taking a stand and pushing a little bit and waiting.
Absolutely. So as kind of parting shots, what else does this group need to know or understand about the things that have made your partnership agile, productive, joyful?
I guess one other thing I would say is I don't think of her just as the head of our fundraising efforts. I think of her as a member of my executive team, and I know what her talents are. And if I have a project that is not exactly what is in her job description, but I know she would be good at it, I'm going to ask her to do it. And I keep her at the executive leadership table all the time, not just to talk about philanthropy, but also about how we're developing our programs, how we're developing our strategies, how we communicate them, and I really leverage that. One of the things that we were doing before we opened was we were going after new market tax credit dollars. Very complicated, very challenging. And I realized after a while that there were similarities to what she does in fundraising. So I came to her and I said, Diane, I'd like you to join our new market tax credit team. And she said, okay, I don't know anything about it, but I'd love to do it. And really leveraged her abilities in that area. Even though it wasn't philanthropy, it still benefited from her ability to communicate, to craft a narrative, and to strategize.
Excellent. Diane, what are your parting words? What do we need to know or understand?
Well, thank you. I mentioned before that the hospital is just the starting line, but all of the intention in Los Angeles was, in those days, on the, are they going to do it? Are they going to get it open? About a month before, in the run-up for receiving licensing, joint commissioning, all of that, we were all 24/7. Now me, what was I doing? I was going around to all of the rooms making sure that soap was in the soap dispenser and checking checklists, but we were all doing something. We had lunch together at a Subway, and over lunch Elaine asked, what does success look like to you? And I thought, well, I said, I think if you're thinking success to me looks like getting the hospital open, that's not what it looks like to me. Success to me looks like getting the community health going and getting all the roots out there in the community, in the ground. And she high-fived me and she said, great, that's what it looks like to me too.
Excellent.
And I think that's having shared objectives, but not quite so formally a shared sense of that challenge. And what is our worthy purpose? Our worthy purpose is bigger than that one thing.
Yes, absolutely. So the power of partnership has enabled these two women to chase dreams that were audacious, that maybe seemed like a moonshot, that may have seemed, frankly, ridiculous at times. However, knowing that they had shared values, relationship equity, and the ability to really find the way to leverage each other's strengths has led to something truly beautiful. Thank you so much to each of you for sharing your wisdom and your expertise with this crowd today. Please join me in thanking Dr. Elaine Batchlor and Dyan Sublett.